What's up, guys? Hope you can hear me good. I got this N95 mask on. But today is the first day of my emergency medicine clerkship. Yesterday I had the orientation. Now today I actually have a shift. I'm working 8 a.m. to 6 p.m. So yeah, I'm gonna head in and I wanna let you guys know how it is after. What's up, guys? So it's actually the morning after my first shift. Last night when I got home, I was just really tired. I hadn't worked like 10 hours, 12 hours since, I don't know, March. So yeah, at first I had to dust some of the rust off. It was cool. My first patient was Spanish speaking, so just a little bit of background about the hospital I'm in. It's like a lot. I think like 75% of my patients were Spanish speaking. So I went in, I had to use the translator. I introduced myself in Spanish. I can do at least that much. And then I used a translator, and it took me a little while, but I kind of got used to it. Then I started picking up more patients. I think yesterday I had about 5 or 6 patients. I wanted to keep it light. I wanted to make sure my quality and my assessments and plans were good. So yeah, so today is Wednesday, and every Wednesday we have conference. It's due to COVID, it's going to be virtual conferences. So we had our first hour not too long ago. We're taking a break right now, and then we're going to keep going until 12. And then after that, I have to go to the hospital, and we're going to do workshops on splinting and suturing. So that's going to be fun. So yeah, I'm looking forward to that. After that, I'm off. I'm going to study, and yeah. Alright, so I don't know about y'all, but I had an amazing shift today. It was really, really cool. It was just great, man. I had a goal. One of my goals, I'll tell you a couple of my goals. One of my goals for this clerkship was to really, treat and participate and see the bread and butter EM, and I've really been seeing that in the past few shifts. So today we had mental status patient who came in. He actually had a hypoglycemic attack while driving his car. We had a stroke patient, TIA patient. We had a guy who his foot got caught with the forklift and he ended up having an open fracture of the foot. I got to do a few ultrasounds today. There were a few traumas that came in, got to participate in that. But yeah, it was cool. Another one of my goals was to really integrate myself into the team dynamic of the emergency department. So a lot of people don't realize, like, maybe not like other specialties, but the emergency department is a team. You got your attendings, your residents, your nurses, your techs, everybody, EMS, everyone. So you really got to integrate yourself. So for me, being a med student, I realized that sometimes med students can be a hindrance to the flow of the emergency department. So whatever I could do to help them doing it. If a patient needs pillows, I'm getting them pillows. I'm getting them blankets. They need some water, I'm getting them water. I had a TIA patient today. I wanted to make sure, she said she needed to use the restroom, so I walked her to the restroom. And that's good for the patient, and it's good for me with my reassessments. I need to make sure her neuro exam is good, making sure that she's ambulating adequately. So yeah, but yeah, this has been pretty much by far my most favorite rotation ever. Everybody there is so nice. The residents are nice. The attendings are nice. The techs, the nurses, the paramedics, everybody. So yeah, it's been a pretty good rotation so far. So. Okay, so it's Thursday, it's my off day, so I thought it would be a good spot to sort of summarize my past couple of shifts, especially since I'm going to be working all 3 days this weekend. So being in the ED is great, it's everything that I thought it would be. It's busy, fast-paced, But most of all, I've been learning. I've learned so much within the past 2 days. It's crazy. So for me, this is my sub internship. So I'm focused on shifting my thought process from an M3 level to an M4 level and really coming up with that good assessment and plan and disposition for my patients. So when you rotate in the ED, it's a little bit different from, internal medicine or surgery. You really want your pertinence here. So when I mean pertinent, for example, when I go to take a patient history and do a physical exam and review a systems in the internal medicine rotation, I'm really just getting a big picture. But for emergency medicine, you really want to focus in and hone on that chief complaint. So if a patient comes in with a chief complaint of chest pain, you really want to focus in and dial in on that chief complaint. So with your history, you want to make sure that you get everything surrounding that. With your review of systems, you want to make sure that you get the pertinent negatives, pertinent positives, and a focused physical exam. I think the biggest thing for adjusting is really coming up with the assessment and plan, like I said before. So you really need to think. You want to put the pieces together, right? Get your assessment, and then now you want to ask yourself, what do you want to do for this patient? Do I need to get a CBC, a BMP, a chest x-ray, EKG? Also, you really want to make sure you address any interventions. So for example, if a patient's in pain, you want to treat the pain. If a patient's nauseous, you may recommend giving the patient 4 to 8 milligrams of Zofran. So it really gets you thinking, and it's really been challenging, but I've been up for the challenge and it's been great. Also, emergency medicine is procedure heavy, so I can't wait to do some procedures. We actually had, like I showed you guys, we had a suture and a splinting clinic, so I can't wait to put that into practice. So yeah, pretty much this has been a great rotation for me. I can't wait to share more with you guys when I have more shifts. I have an ultrasound shift coming up, pediatric shift coming up. So this is really just a sneak peek, day in the life sort of kind of vlog. I hope you guys enjoyed. If you have any questions or any comments or anything that you want uploaded, make sure you drop it down below in the comment box. I'll be sure to get back to you. Don't forget to follow me on Instagram at YouCanMD. And don't forget to get your YouCanMD merch at YouCanMD.com. That's it this week. I'll see you guys next time.